So it is my pleasure to bring Dr. Flavia Vaduva up for her talk this morning. And I just have to say, for both Dr. Nascimento and Dr. Vaduva, when I read both of their resumes, when I found out that they were coming here, the first thought that came through my mind was, I think Hills needs to take some lessons from K-State on how to find amazing people. Because my goodness, these both of them have just been such a pleasure to work with while they have been here this year. Dr. Vaduva graduated in 2015 from Huff Graduate School of Business at the University of Florida. And she is a 2016 graduate of the University of Florida College of Veterinary Medicine. She completed her MBA at West Texas A&M University in 2019 and is currently pursuing a PhD in global business management through North Central University. And she is also currently serving as the Tennessee/Kansas State nutrition resident and is in her second year of her clinical nutrition residency. She worked as a general practitioner and in various industry roles for 6 years prior to pursuing this nutrition residency. And we have really, really enjoyed having her here, and I'm excited to see what she has to discuss with us this morning.
All right, good morning. Can you guys hear me okay? All righty, so thank you to Hills, K-State, and all of you for being here today. As was mentioned, my name is Flavia, and as my girl Jordan Sparks here just said, we're going to be talking about how to take one step at a time into how to integrate clinical nutrition into your practice. So we'll go ahead and get started with an overview. The first thing we'll discuss is the human-animal bond. That's really the basis of kind of the rest of this discussion today. And the reason for that is because ultimately the idea that we're bonded to our pets is the reason that we want to feed them healthy and nutritious foods. This leads into where the current state of veterinary nutrition is today, as well as a disconnect. This is kind of the area of my research for my PhD, which is essentially the difference between pet owners' needs, wants, and expectations as it relates to pet nutrition and what veterinarians are providing, in their day-to-day veterinary visits. We'll kind of briefly cover pet owners' expectations, their experiences, their beliefs, their behaviors, as well as on the opposite side, veterinarians' beliefs and behaviors as it relates to pet nutrition. We'll further explore what I call the mismatch. This is not necessarily coined in the literature the way the disconnect is, but this mismatch is basically the difference between veterinarians' beliefs about pet nutrition and the way they're behaving and acting in their day-to-day life. Next, we'll go through how to incorporate veterinary nutrition to your practice. I do want to make sure that I'm very clear up front that this doesn't replace nutrition consultations with a veterinary, boarded nutritionist. This is just a way that you can incorporate this into your day-to-day lives. And this is something I wish I had done when I was in general practice. And lastly, we'll end with a case example. But before we start, I'm going to start with a story. And the story is that of my own dogs. These are two dogs that I went to high school with, that I went through college with, and that graduated vet school with me. And that top photo is blurry because that was an actual photo because that's how long ago I graduated vet school. But I know that I'm not alone in this, right? So the human-animal bond doesn't just pertain to me. This is a photo of me and my husband, who's here today supporting me, at our wedding. And you can see our dog was our ring bearer, right? So we had a very small wedding. We had 10 people there, our closest friends and family. But the person in the front row, or the member of our family in the front row, was our dog. And the literature supports this as well. We know from the companion animal bonding score that was in a survey in 2019 that almost 90% of pet owners say that they are highly bonded to their pet. And now I'm going to provide you more evidence with how bonded we are to our animals. So how many of you received a tote today with a picture of your pet's photo on it? Raise your hand. Yeah, exactly. We're in good company, right? We're very bonded to our animals. And this changes how we feed them because we're very, very bonded. We consider them members of the family. One study showed that 95% of pet owners consider their pets family members. Yet here is the current state of veterinary nutrition. So even though people are very bonded to their pet, they want pet advice. I'll show you some literature that demonstrates that. We're still only discussing nutrition about 60% of the time during veterinary visits, according to one study. About half of those surveys also showed that only half of the time, those surveys also showed that only half of the time are we collecting diet history forms. And I know things get busy in general practice. I was definitely there, I understand. But this is a really key component of starting the nutritional discussion and recommendation. And then lastly, only 30% of respondents said they always conducted a nutritional assessment. And this varies as to what they mean by assessment. As we heard from Dr. Nascimento's wonderful talk, Assessment can mean body condition scoring. It can mean muscle condition scoring. It can mean a lot of different things to different people. But the overarching theme is that that was only done about a third of the time, according to this study. This is some data I collected very early on in my PhD. We surveyed or collected information from 1,000 different clinics because we were curious to find out how many of those visits were nutrition related. And as you can see, a very small portion of them were nutritional. Yet if we look at the number of pets that are coming in for preventative services, that's a really high number. And all of those pets have to eat, right? So in theory, the amount of nutritional advice or recommendation should equal the amount of pets you're seeing in your practices, because all of them at the end of the day would benefit from some sort of nutritional recommendation, whether it's a healthy pet or a sick animal. And this is what I hear when I ask my friends that are still in general practice, when I ask them, why is nutrition not being discussed? I hear it's, well, because pet owners are not asking for nutrition advice. But how many times do pet owners come in asking for a dental cleaning for their pet? Very rarely, right? So this is something that we have to be proactive about in starting that discussion. And consider from a business perspective, the advice from Steve Jobs that we need to get closer to our customers than ever before. So close that we figure out what they need well before they realize it. That's our job as veterinarians, is to inform pet owners of what would benefit their pet's health. We heard earlier from the overweight and obesity talk that is a really big epidemic, right? We heard that about 60% of dogs and cats are affected by that disease. Yet pet owners only recognize that about 32% of the time. And of that 32%, only 0.3 actually think it's a health problem. So we may know that obesity is very related to dietary habits. We know that it leads to all those different conditions. But pet owners may not be aware of that, and it's our role essentially to educate them about that topic. So I do think that clients need nutritional assessments and recommendations, even if they're not asking for it. We know that they want that advice, and I'll show you that on the next few slides. But more importantly is the bottom line, that better business practices, so incorporating nutrition into your practice, leads to better lives for pets. And that's really the most important part of business, is not the bottom line necessarily from a profit perspective, but that it will lead to a better life for that pet. And here's the disconnect. So in 2016, a paper referenced a paper in 2003 that spoke about how essentially 90% of pet owners wanted a dietary recommendation, yet only 15% recalled receiving one. And I know recall bias is important to consider. Some of them may have been given a recommendation and maybe they just don't remember it. But in the end, about only 15% walked away with some sort of nutrition advice that they can remember. It got better over time. So in 2020, we found that 43% of respondents thought they received some sort of nutritional advice for their pet, but that's still only half of the amount of people that actually wanted information that they thought could be beneficial. So this suggests that there's a communication disconnect between our profession and the needs and desires of pet owners. And here's what happens when we don't provide nutrition advice, right? Pet owners figure out other ways to feed their pets, and that may not be from the most reputable sources. They go to the internet, they go to other media, and what does that result in? It leads to fewer dietary recommendations, especially therapeutic diets. One study found that about 12% of veterinary visits resulted in a long-term dietary change recommendation. They may choose to feed incomplete or unbalanced diets, raw diets, or they may follow marketing trends that are very influential. As we know, we probably all see commercials these days. It's very easy for pet owners' behavior to change as a result of those marketing campaigns. And they may add supplements to their pet's nutrition plan that aren't always beneficial for the animal, and in some cases can lead to toxicity. So here's what we know about pet owners' experiences, beliefs, and behaviors. So we know about half of them give equal or more priority to buying healthy food for their pets and for themselves. And I'm laughing at this because my husband and I have recently started cooking at home for our cat that has a food allergy. We're doing a lamb-based diet, yet I'm still eating ramen noodles and combos from the gas station while I'm making that for my pet. That literally happened this week. But we care about our pets, right? We're bonded to them. We want them to have healthy and nutritious food. We also know that this is difficult for pet owners. So they say that choosing the right food for their pet is the most difficult part of pet ownership. That is very interesting to me. So they don't talk about struggles with the pet's behavior, their training, their medical problems. They have a hard time choosing the food, and we can help with that. And in that same survey, about half of them said that nutrition was more confusing for their pet than it was for themselves, and that leads to them feeling overwhelmed. But here's the good news. So they have really promising beliefs towards veterinarians and our advice regarding nutrition. So about 3/4 of them trust their veterinarian's recommendation. About 85 of them highly value the nutrition advice they receive, especially when it comes to a pet with a cancer diagnosis. And that's going to be the condition that we focus on the rest of this talk. About 90% of them are willing to change their feeding practices. This is very important. This is not true across the board in terms of other conditions. This means that we have a really high rate of being able to influence their decisions when it comes to pet food and feeding behavior. But in order to influence behavior, we have to understand what they're doing. So what they're doing is they're getting information from multiple sources. So less than half are getting that nutrition info from their vet care team. About 1/4 of them are going to the internet. About 15% or so are going to other sources, whether that's animal nutritionists, which is very helpful, but there's also a lot of unhelpful sources in that category as well. And then the rest are looking at a combination of sources. But here's the thing, their behavior changes when their pet is diagnosed with a particular disease. And the reason I share the story about my own dogs is because what you may have picked up on in that photo is that one of them, the Rottweiler mix, had a shaved arm, and that's because he was going through the CHOP protocol during the time that I was graduating vet school. And my behavior changed in the way that I fed him, right? So he was one of the few dogs that did have adverse effects after chemotherapy. He did lose his appetite. He did have to be hospitalized. And that happened several times. And my behavior changes as a result of that, right? So I didn't feed him complete imbalanced food all the time. I fed him whatever he wanted to eat that day, whether it was, some days it was pretzels, some days it was other foods. And I think that's really important to note that your pet owners are doing this too. We know that 50% of them are going to the internet to get advice after a pet's cancer diagnosis. Most of those are also looking at nutritional supplements as well. Even scarier than that is that they're going to blogs and social media to get advice as well. So this is an area where we can really make a big difference in hiring people or seeking advice from people that are actually able to provide sound nutritional advice. So once I went on, I finished veterinary school. The other dog in that photo was diagnosed with cancer. And I did find a veterinarian who practiced holistic medicine that was able to provide some nutrition advice, provide information about adjunctive therapies, supplements. So that was definitely a step in the right direction of getting really sound nutritional advice. So the reason I share that is to say that your pet owners are doing exactly what I did. So it's important to intervene and ask them when their pet is diagnosed, do you want nutrition advice? Do you want to set up an assessment so that we can discuss what would be best for your pet? Do you want to make a plan? I'd love to see your dog, as they're going through the CHOP protocol. I'd love to see them in every 2 weeks or every month so that we can really make sure that they're maintaining their weight, their body condition, and their muscle condition score. And they're changing their feeding practices too. So they're not just looking for information in other sources, they're changing their behavior as a result. And here's what they're doing. So over 50% of them are going to pick home cooked foods or supplements, as I mentioned. About 40% of them are going to use home prepared cooked meals, which is better than home prepared raw meals, but about 20% of them are feeding homemade raw diets. And they change their behavior when it comes to supplements too. So we know that if the pet is healthy, a survey of pet owners showed that they'll feed up to 226 different supplements. If the pet has a cancer diagnosis, they will feed up to 279 different individual supplements. And many of those may be unregulated. There was a great talk at AAVN this year, which is the Veterinary Nutrition Conference, that showed that 4 dogs in the same family passed away due to vitamin A toxicity in a fish oil supplement that was over the counter. So when we think of supplements, not all of them are benign, and in fact, some of them can have toxic effects. So that's why it's important for veterinarians to get involved in the nutrition discussions so that we can help guide them. This topic is important enough to be in JVIM. So this was an article published in 2022 that spoke about how the pet owner does change their supplement and diet use when their pet is diagnosed with cancer. So what we know is that the majority of pet owners are self-formulating their diets. The next most common information source is veterinarians, and that behavior changes after the diagnosis. Thankfully, it does go down in terms of the self-formulated category, but it also goes down with the veterinarian category too, which isn't great. And furthermore, a study in 2012 by Heinz showed that 27 home-prepared diets were deficient in 1 or more nutrients, even if they were formulated by a veterinarian. So as far as home-prepared diets go, I really think that needs to be kind of within the realm of a boarded veterinary nutritionist. So as much as I do advocate for sharing nutrition advice in general practice, I do pretty strongly believe that should be mostly limited to commercial products only. So we've talked a lot about the pet owner, and here's what we know about the veterinarian side of things. We know that most of you have an interest in veterinary nutrition, right? So one, because we've asked you and we'll go through the survey results, but two, because it's in the literature. So we know that about 75% of them believe that inappropriate nutrition is a concern to animal welfare, and most are interested in healthy pet nutrition. Yet, even though we have this interest, and even though pet owners are clearly wanting nutrition advice, they're still not receiving that information during their veterinary visits. So Alvarez in 2022 looked at barriers to why nutrition is not being discussed, and they found the following. So during healthy pet visits, there's resistance to brand changes. That's very understandable. We know that from the literature. Brand loyalty applies to both the pet owner and the pet's food. So if a client is very dedicated to a certain brand of food, they'll probably be very dedicated to their pet's brand of food. There's also time constraints. That's always going to exist in veterinary medicine. There's online misinformation. I actually don't see this as a barrier. I feel like this is actually a great opportunity to provide them very good advice. Product changes. Things do change over time. There's no doubt about that. One of my mentors is both a veterinary nutritionist and a PhD, and I've heard her say, it's hard to walk into a pet store and know what a good quality food is. There are so many options out there that does make it really challenging. So some of these barriers are definitely very valid. And then in a sick pet visit, we're worried the pet may not accept the new food. That's absolutely fair. We don't want to cause an adverse reaction to the food. Time constraints, again, that's just always going to exist in veterinary medicine. I feel like that's going to be true with any type of service that you're going to offer. And then this last line here is interesting. More than half of veterinarians received very little nutrition training in veterinary school. I would argue with this, though, we only receive very little dentistry training as well, yet we're not avoiding dentals, right? So I know I went to the University of Florida. I did a week of dentistry. It was mixed in with our primary care. There was an elective. I wasn't selected for it. So ultimately, that didn't mean I didn't go to practice and have to, do CE, learn how to do dentistry, find a mentor, so on and so forth. So I think some of these barriers you can definitely overcome. And you don't have to overcome all of them to talk about nutrition. I think you can pick and choose. The whole point of this talk is to take it one step at a time, right? So here's what we know about this audience's particular behavior. So thank you for answering our kind of pre-conference survey. I did use the word consultation when I originally developed this survey. Again, I do want to just stress that when I say consultation, I don't necessarily mean with a specialist. I mean a visit in a vet clinic with a veterinarian or a veterinary technician or assistant that is specifically to discuss nutrition. So moving forward, I'll replace this word with assessment, but this is the way the survey was originally written. So we asked, does your practice currently offer nutritional consultations? Fairly unsurprisingly, about a third of you said yes. The majority said no. This is pretty in line with what I experienced when I was a general practitioner as well. But what was interesting to me is actually the next slide. When we asked you, are you comfortable making nutrition recommendations? Actually, the majority of you said yes. So this is interesting to me from a business perspective, because if you're comfortable doing something, why is it not being offered, right? That's like having information that you're not sharing with a pet owner and you're not helping to benefit that pet's nutrition. If we look again at the next question on this first slide here, are you charging separately for nutrition consultations? The majority of you said no, about 75%, so 3/4. I think this is a big missed opportunity. I don't think you have to charge for your nutrition appointments if that's something you want to do to build relationship with your clients. They like, know, and trust you, and you're using it as a measure of goodwill. I think that's fair, but this is a business talk, so of course I'm going to encourage you to charge for your time. Otherwise, I would be kind of missing the mark of this whole presentation. And so I do think these appointments should be set up separately, because at the end of the day, time is your most valuable resource. It's everybody's most valuable resource, right? Every other resource we can work around. We can't work around time, and nutrition takes a lot of time. I went from seeing 15-minute appointments before this residency to not being able to get through a single nutrition appointment in under 45 minutes, and even that's kind of a stretch. It usually takes about an hour to be very thorough. So I think we have to recognize we've put a lot of time in learning nutrition, a lot of time in our veterinary training. Those services should be charged for appropriately in your practices. And then when we asked you, would you like to offer nutritional consultations to your clients? About 20% of you said no, that's okay. There's going to be doctors in every practice that maybe don't want to do surgery. There's some doctors that really enjoy the medical part. I think it's okay to have those preferences. The key is to know, one, is there a point person in your practice that you can kind of guide clients to for advice. And then always remember you need to have the ability to refer clients to boarded nutritionists as needed as well. So we talked about that there's going to be several steps to kind of incorporating nutrition, and you've already done step one, which is great. That was the assessment or the survey that we sent you guys. I encourage you, if you didn't go through that or want to go through it, these are the questions that we asked you, and this is kind of the algorithm of how I would recommend to go through that information to really figure out if you think this is a place that you want to incorporate into your practice. Two resources that I think are very helpful would be the Vetfolio Pet Nutrition Coach Certificate that's offered through it seems like a sponsorship with NAVC. I went through this course. They also have like a more advanced version of it. I think it's very good foundational information. And then a more practical course that one of my mentors developed is the pet nutrition class. I included the link there. That one is about $50. And I do think it provides very practical advice that general practitioners can really benefit from. The next step is pretty easy. Someone has to start talking, right? So I'm pretty introverted by nature. But when I'm put in social situations, I always tell my husband, I always feel like I have to start talking. And that's really what we have to do with nutrition as well. Someone has to get the conversation going because those pet owners are wanting that nutrition advice, right? They're telling us that in these surveys where 90% of them expected a recommendation from you. So someone has to start the discussion. Here are some do's and don'ts for how to guide that conversation. So it's important to discuss the diet in the context of pet health and well-being. This is to say that veterinarians tend to do things that reflect how they see value. So the way that we tend to see value is in the time that we spend and the service that we're providing, and that makes sense because we've invested a lot in ourselves to be able to provide those services. But to the pet owner, that's pretty irrelevant to them. All they really want to know is how is that going to benefit my pet? So when you start the discussion, it needs to be in the context of their pet's health and well-being, and not necessarily this diet plan is going to take me 4 hours, which sometimes it really can. But that doesn't benefit their pet, right? So we want to discuss it in the context of pet and health and well-being. But here's the thing. It needs to be in the context of that particular pet's health and well-being. It can't just be health and well-being in general because that doesn't resonate with them. So what we tend to do as veterinarians, and I've done this myself, or veterinary assistants or veterinary staff, is we tend to say, well, I feed my pet this. And that seems to carry a lot of weight, or we seem to think it carries a lot of weight. But when pet owners were surveyed in 2021, it really didn't resonate with them. What they care about is their particular animal and how that particular diet will help their specific pet. And then lastly, sometimes we can get caught up in different marketing strategies and everything. So some products have very unique packaging or attributes to that, but that doesn't resonate with pet owners that well either. What they care about is the health and nutrition attributes of the product. And remember, this is because the pet owner wants to feed the pet as they feed themselves because the pet is part of their family. So if they're eating healthy and nutritious meals, they want their pet to have healthy and nutritious food as well. The next step is to collect diet history, information, and perform a nutritional assessment. So the diet history form is one that I recently challenged myself to start using. I got the great opportunity to rotate through our pet health rotation recently. So I downloaded this form. It's very easy to find. You just Google the WSAVA website, and you can download it and start implementing it. And I think it's just a habit to get into. And it was actually, I found a very easy habit to get into. Within a week, I was doing this pretty routinely. This is very different than the diet history form we use for our nutrition appointments. Ours are a lot more extensive, but I wanted to put this into action so that when I stood up here to recommend this, I had actually done this before sharing with you guys that I do think it's a great resource. But if you want to take it a step further, then I think the nutritional assessment checklist is a great next place to go. So if I was trying to implement this in my practice, I would try to engage the veterinary assistants and veterinary staff into helping fill out the short diet history form. And if I was planning to offer nutrition appointments on their own, I would definitely try to get in the habit of filling out the nutritional assessment checklist. And this checklist does a really nice job because at the bottom, it basically tells you that if you've identified several risk factors, then that's probably a stopping point. There is a second page to this assessment. But I feel like if you're going to the second page, then that's a pretty clear indication that it's probably time to get a boarded veterinary nutritionist involved. And what about staff? So I mentioned earlier about the potential role of veterinary assistants and veterinary technicians. And I think it's important to start with what pet owners are saying so that we understand how those staff members could be beneficial. So a study in 2019 found that when pet owners were asked to rate the importance of recommendations coming from different members of the healthcare team, both veterinarians and veterinary staff members were ranked to be of the highest importance. And this is wonderful news because it means that the pet owner is highly valuing the advice that they get from different individuals in your practice. So in the same way that we want to be on the same page when we're making heartworm recommendations, right? How many of us have heard that where an assistant goes in and recommends heartworm prevention and they come out and they're like, hey doc, can you also recommend heartworm prevention? Because I don't think it got through the client. And then someone else in your practice is recommending it as well, right? That alignment is what is sending the impression to the owner that this matters to everybody in the practice. Everyone is on the same page about the importance of heartworm prevention. I'm from Florida, so like that example really resonates with us just because we have so much heartworm disease. But I think in general, you can replace that with any recommendation that you're giving to your pet owners consistently, time and time again. The more they hear something, the more they're going to recognize that it is very important. And there's a lot of benefit to the clients from doing this. So in involving your veterinary staff, you're building relationships with your clients. So your veterinary staff probably has a little bit more time than you do as a vet to really engage with the client. They're usually asking them about their day, about their family, about their other pets, because they don't have to be the key decision maker, right? So I was an assistant for about 9 years before I became a vet. I was an assistant until the Saturday that I graduated vet school, actually. And I definitely saw the difference when I graduated, when I had to make all those key decisions. I didn't have as much time to really get to know the pet owner and really understand their family dynamics, their pet dynamics, so on and so forth, right? So by engaging your technicians, they are building those relationships with clients, and the clients will like, know, and trust your practice more as a result of it. That benefits them because they're getting more attention. They're getting more people that are listening to them. But it also benefits the technicians or assistants. There's a study in 2022 by Driscoll that showed that autonomy and competence are two very important factors to veterinary technicians feeling intrinsically rewarded by their work, right? So we have extrinsic rewards like salary, benefits, et cetera, which we know that there's a long way to go to fairly compensating veterinary staff in that realm. But something that we can impact is the intrinsic rewards. And by giving them a sense of autonomy and ownership, as well as a sense of competence over nutrition and helping with those diet history forms, collecting the information, understanding the different products, sharing that information when it's appropriate, that can greatly benefit their autonomy, mastery, and purpose over this subject area. And there's a benefit to the pet. The more people that are involved in the pet's care, the more likely it is the pet owner will see that this really matters. It is very important for their animal. They're probably more likely to bring them in for their, as Dr. Nascimento was saying, for their check-ins, they're checking their weight, their body condition, their score. But particularly when it comes to pets with cancer, I think those appointments are also important just for measuring the quality of life of the animal, right? So when I set up that appointment with the holistic veterinarian, part of what I asked her wasn't just to give nutrition advice, right? It was to have somebody there that could assess how my dog is actually doing overall, because it's really hard to be objective during those times. And here's my next step. So if I've identified that I want to offer nutrition advice or a recommendation or a plan for a particular condition, and I've picked cancer because it matters to me or I see a lot of it in my practice, then what I'm going to do next is I'm going to understand what happens with that condition in terms of their nutrition. So we know with cancer, for example, their protein and fat stores can be simultaneously affected. Cachexia can lead to different effects to where they're losing weight very quickly, losing muscle mass. That definitely affects their quality of life. It affects the pet owner as well. So if I were to look at this condition and think about what do I need to do diet-wise, I would pick a diet that's, first of all, complete and balanced, so not pretzels like I was feeding, and choose a diet that's highly palatable because we want their appetite to be as consistent as possible, because that's not only important to the pet, but it's important to the pet owner too. And if the pet's going through a chemotherapy protocol, one thing that may make them stop that treatment is if the pet isn't eating consistently, and I can tell you that's absolutely true from my own experience. So here's what we can do. Thankfully, there are diets on the market that are complete and balanced. They're designed for pets with cancer, such as the OnCare diet. I went to the Hills Global Symposium this year. I was very fortunate to be invited to that, and we learned that they also have this product in Europe. It's called the OnCare diet there. So that means that this diet isn't necessarily just for pets with cancer, but in the US it's called OnCare. And it is appropriate to feed as long as they don't have fat-sensitive conditions. So as long as they're not a pet that's had a history of pancreatitis or hyperlipidemia, so on and so forth. Essentially, what I would do is, if I was trying to select a diet for a pet with cancer, is I would think about what's a food that's highly palatable, what's a food that's complete and balanced, and then I would look at these different features that you see on this chart here and figure out how I could explain that to a pet owner in a way that benefits their pet's health and well-being specifically. So if I knew that that pet was losing muscle mass and the owner was very concerned about that, I would say one of the key features is they have high amounts of amino acids and L-carnitine, and that can help support your pet's muscle mass. So make it specific to that pet. Next, I would do my product research. So I would look online, look at PubMed or other search engines for different papers and see, what are the different studies that are out there about that product that I'm interested in. Not necessarily because I'm going to read these studies to the pet owner, right? Because they just want to know how it's going to help their pet, but because it's very helpful for me to have that background knowledge to feel confident in my recommendation that there's research supporting the use of this product. So for this diet in particular, for example, 97% of pets were successfully transitioned to it. That's really important for pets with cancer, right? The last thing a pet owner wants to see with their pet that's undergoing chemo or radiation, or maybe they're just doing palliative care, the last thing they want to see is that their pet's not eating the food. With this diet, the eating enthusiasm score was high and continued to stay high throughout the diet. And there was subjective measures of what I would consider quality of life, where pet owners reported things like acting like normal today. That's an amazing statement for a pet owner to say with a pet that has cancer. Or the dog is joyful today. I can't imagine there's any pet owner with a pet with cancer that doesn't want to hear that their dog is joyful today. In a different study, they found that there was a significant increase in body weight and body fat index. Again, these are all ways that we're subjectively assessing how the pet is doing. So we want them to eat, we want them to maintain their body weight and their body fat percentage. And here's how I would put it all together. So the disclaimer here is that you can insert any kind of combination of numbers into this spreadsheet. When I was in my MBA program, I did a lot of forecasting. Some of these numbers are assumptions that I used at that time. Some of them are pulled from Forbes, and it's going to vary, right, from region to region, from practice to practice. And you may not want to use a nutrition plan like this altogether, and that's totally okay. This is just one way that you can incorporate nutrition into your practice in a way that's very structured and very easy for the pet owner to follow. So these numbers, essentially what I pulled these from, so with the revenue, and yes, I understand that there's overhead that's not accounted for here. This was just simplified for the purpose of this presentation, but essentially with revenue, I said that the veterinarian is charging $90 for a nutrition plan. That's variable. That can change based on your practice. I included the exam fee in that as well at $60. Again, I know that can change based on practice. As far as time goes, I think at least a half hour would be needed for that initial appointment. Like I mentioned, it can take up to 45 minutes for me, but I'm still in training, so maybe that'll change, once my residency concludes. Or it may not, and this could be adjusted over time, and the cost could be adjusted upwards as needed. The cost of the clinic is very low, right? Because in this situation, we're not accounting for overhead, but really all you need to do nutrition from a commercial diet standpoint is like your computer, which you're going to have in your practice anyway, and a calculator, which most of you have on your phone. If you want to get fancy, you could use a tape measure and do all the measurements for the pet and everything, but those are pretty inexpensive anyway. So let's say you develop this nutrition plan when this dog is diagnosed with lymphoma and they're starting the CHOP protocol at a referral specialty, and you want to keep tabs on how this pet is doing throughout their protocol and hopefully beyond. So maybe you see them in month 1 after they go and they start their plan with the oncologist, and then you have them come back in 2 weeks later. If you have a vet tech, that's wonderful. If you don't, it's also okay. You can set up that appointment, under the guidance of a veterinarian, to have a veterinary assistant just collect information, as long as that's within the scope of your practice, of course, in your particular state. Just have them collect the information, and they can go over that with you. You can, charge accordingly. Of course, that can change depending on if it's a vet tech or vet assistant appointment. But what shouldn't change is the amount of time that they spend. So as you can see here, I did lower the amount of time that the veterinarian spends over time, but I really strongly believe the vet assistant or vet tech should spend at least a half an hour with that client every time they're coming in for a nutrition appointment. And again, that's not because It always takes that long to discuss nutrition, but because you're also checking in on other aspects of the pet's quality of life during that point as well. With kind of the progression throughout the protocol, I put the rest of the rechecks as monthly. Of course, this can change, but based on how the pet is doing. As I shared with you, my dog was in the 5% that did have side effects, so his plan was not this smooth. We had to make a lot of changes. He was hospitalized multiple times. But I'm assuming in this situation that things are going pretty smoothly. So let's say by month 3, now you notice, or now the pet owner notices that he's not eating as well. He's not enjoying the food that was initially prescribed. Maybe he's losing some weight. So you have them come back in. And at that point, the veterinarian gets involved again to do, a recheck, really assess the pet's health at that point and update the nutrition plan. Maybe you're going to choose a different product. Maybe you're going to use a Palatin or a topper or something to enhance the palatability of the diet. Or maybe you're going to change the medications, right? Maybe you need appetite stimulants, Serenia, ondansetron, or other medications at that time. Maybe you got the pet back on track and now you're in month 4 and you just need them to come back in for a weigh-in. That could be done by your assistant or your vet tech as well. Now they're in month 5 at the end of their 19-week CHOP protocol. You definitely want to have them come back in, reassess where they're at. You're probably going to need to update the nutrition plan at that time because now they've undergone about 5 months of treatment at that point. And if you were to do that, you could see the total kind of profit to your practice. But again, as I said in the beginning, the profit really isn't the bottom line of this presentation. The key is that these better business practices of incorporating nutrition in your practice leads to better lives for pets. So just remember, starting to make nutrition recommendations one step at a time can absolutely benefit your practice, your clients, and most importantly, your patients. It's not discussed as often during veterinary visits as clients expect, as we spoke about in the beginning. And the steps to kind of correct that would be to do a self-and-practice assessment, start the discussion, collect diet history forms, and perform nutritional assessments. Get your technicians or your staff involved, assess conditions and products, do your research as we discussed. But consider also that the pet owner has to be pretty invested in this process. They have to provide the diet history form that's completed thoroughly. They need to comply with the plan. And just remember, you can definitely just take it one step at a time. And with that, I'll say thank you again for joining us today, and I'll take any questions, comments, or song requests at this time.
About having your technicians be involved,
Yeah.
when does the technician appointment become too complicated, or what things should the technician be looking for where they need to get the vet to step back in?
Yeah, that's a great question. So it depends on their level of comfort, for sure. If they've taken any nutrition training themselves, I think it's going to vary pretty widely. So I think, for either a vet assistant or a vet tech that's not trained in nutrition, I would definitely have them involved in collecting the information as much as they can with the diet history form, talking to the pet owner, getting the weight, the muscle condition score, if you're doing measurements, taking the measurements, so on and so forth. And I do think they should be running any changes past you. So even if it's something as simple as hey doc, the pet has lost some weight. I want to ask you if you think we should increase the food by 10%, for example, and then you just kind of look at the math, check the calories, check the pet's weight, and adjust accordingly. So I think simple things like that are completely appropriate. If the dog is inappetent, they're not eating the food at all, or they're vomiting, they're having diarrhea, they're nauseous, I think all of that should, then become a veterinarian appointment. That's a good question, though. But it depends. Oh, sorry. Yeah.
Making Dr. Hal to exercise a little bit this morning. Thank you, Dr. Vaduva. Amazing talk. I was curious with the collecting diet history information. That's, for me, being nutritionist myself, that's the biggest hurdle.
Yeah.
Do you have, based on your practice, any tips on how to get really good diet history and how you overcome some of these barriers? You can even list what they are. Yeah. Based on your experience. I would really love to hear from you on that.
Yeah, so I'm really glad I went to rounds yesterday because actually Dr. Hull did a great presentation on how to ask the right questions when you're collecting a diet history form. So essentially, I did find this happened to me a lot when I was in general practice, where I would ask a question and I would think it's an open-ended question, but then I would get kind of this one-word response, and then I would have to keep asking questions, and it kind of felt like an interrogation, right? I would ask what are you feeding your pet? They would answer. Then I would ask, how much are you feeding your pet? What time of the day? Are there other pets in the home? So it was a very kind of one-way conversation. So something that Dr. Hull shared with us yesterday that I thought was really helpful was just to remember to phrase the questions in an open-ended manner and say things like, tell me about your pet's morning routine when it comes to feeding. And what we saw when we asked the students that yesterday is that essentially they're more willing to give a lot more information that you need to collect anyway. And according to the research, it doesn't take that much more time. It takes about 30 seconds on average longer to ask those open-ended questions than it does to kind of go through those closed-ended questions like I was asking. So, it's a good question. Yeah, and thank you, Dr. Hull, for doing that yesterday. Yeah.
Students, because pretty much almost reliably every time we do that with the students, we ask them those like, what are you feeding your pet, you know, like how much, how often, and we get like the very basic pieces of information on, you know, whatever the main brand of food is, basic information about how much they're getting fed. And then, you know, I ask them the question the same way of, you know, just tell me about everything that goes into your pet's mouth, like from the time they wake up till the time that you go to bed. And like all of a sudden we get kind of the whole story of the pet's day of like not just how much they're being fed, but when, like if they're doing, you know, other like little treats, little small things throughout the day, kind of when, usually why they're doing them. Like it's, you know, it's a treat because they're going outside, or they get a little reward when they go in their kennel for the day. And like just sitting there and watching all the students just kind of all of a sudden realize, pick out all this new information they got by literally just asking one question versus me having to ask 6 or 7 questions to get basically the same, if not actually less information, and doing it in basically the same amount of time. Because it was a study that they actually did up at Guelph where they practiced that with vet students. They had them either do kind of that traditional approach versus the walk me through, kind of tell me about your day. And it was like, I think it took like 15 seconds for kind of that more traditional approach versus the walk me through took about 45 seconds to get a much more accurate diet history, where at least got up to about, I'd say about 50-50, where you got all the other kind of little things people are doing throughout the day to, you know, the little treats and stuff like that.
It adds up. Absolutely. Wonderful. Well, thank you guys again. And I hope you have a good rest of the conference.
All right. Yes. Thank you so much, Dr. Verduva, for all of that wonderful information. And I will also just throw another little plug in here. Not that I'm biased at all, because I may or may not have been a person that had a heavy hand in developing this. But when it comes to nutritional education resources, on the hillsvet.com website, we have a Hills Veterinary Academy that is completely free, and it is a wealth of wonderful nutritional and just general veterinary medical educational resources for you as veterinarians. So it's all race approved CE, and there's everything from webinars to kind of do at your own pace nutritional modules, pretty much anything you could want. And also including some, you know, handouts for clients, educational materials, things along those lines, would be another wonderful supplement to all the wonderful things that Dr. Verduva shared.